President Trump says he's launching a second coronavirus task force now. It's going to launch on Tuesday, and it's going to focus on when and how to reopen the U.S. economy. Joining us to take a look at the economic forecast, we have got former administrator of the U.S. Agency for International Development and president now of the Rockefeller Foundation, Raj Shah. We're also joined by Paul Romer, New York University professor and co-recipient of the 2018 Nobel Prize in Economics. Gentlemen, the two perfect experts to join us on this Easter Sunday to break this down. Thanks for your time. Paul, I'm going to go to you first because President Trump said a couple of times this week that he's going to oversee what he's calling the biggest bounce back in U.S. history. But take a listen to this, what he said the other day about the economy.
Well, I think the economy is going to do very well. Now, that's just my feeling. It's a strong feeling. I've had good, proper feelings about a lot of things over the years, and I think we're going to do well.
Paul, what is your feeling about where the U.S. economy is headed?
The first thing to keep in mind is the quicker we can get started with a recovery, the more likely we'll make it all the way back to full recovery. And of course, the less we'll lose as we wait. So it's very important to get going on recovery. But to do that, we have to first make sure that it's safe for people to go back to work.
Presumably you're talking about the platform, the stand you've taken this week, which is that widespread, sort of ubiquitous testing is going to be the key to getting the economy open again, the key to getting people back to work, right?
Absolutely. And the way to start with this is to provide it to the people who are already at work. Think of our essential workers, healthcare providers, sheriff's deputies, the ones who are delivering these pizzas. One of the first things we should do is make testing available to them, so that if one of their colleagues happens to be an asymptomatic carrier, has no symptoms, but could be spreading the virus, you catch with a test that that person's infected, you don't let that person infect all of his or her colleagues. So that kind of strategy of test and then isolate the people who test positive, this is the way to keep the pandemic under control, even as the rest of the people who aren't infected go back to work.
Raj, coming to you, what do you see right now in the sort of medical pipeline, whether it's the race to a vaccine or these antibody tests that Paul just mentioned? What are you seeing that's giving you the most hope, that looks the most promising in terms of whether it's preventative vaccine or treatment for coronavirus?
Well, thank you for having me, and happy Easter. I'll start by just saying that, this is actually a tremendous crisis. And the first thing we have to do to get people back to work and to protect essential workers, which include all the folks that Paul mentioned, but also the frontline health workers who are my sister is a physician, who are rushing into the hospitals to take care of folks who have COVID-19. And the reality is, to protect that population, broadly speaking, we need to move from hundreds of thousands of tests a day to many millions of tests a day at a minimum. And that's going to take a big national effort. It's going to take a lot of public investment. It's going to take cities and states all working together with the federal government. We need biotechnology companies, scientists, university labs, all working together to achieve that goal, because we're at war and we can win it, but we can only win it with a broad effort around testing. I think we've seen a number of very promising efforts, including from Abbott, the new test that they're rolling out in Detroit and some other cities. We see a whole host of serum antibody tests that could potentially identify who has immunity. But the first goal has to just be scaling up access to the traditional PCR testing, so we know who has the virus, who doesn't. We can do it cheaply. People get results within minutes. The technology, we think, is there. It's about having a national strategy and a big public-private collaboration in a time when our country desperately needs it.
Which is, we're running short on time, unfortunately, but if one of you gentlemen could lay out for us, the Rockefeller Center is rolling out this new national strategy for testing. Could you give us a very quick overview on what's contained within the strategy?
Well, let me
absolutely.
Let me
and I'd say
describe
first,
what the goal is, because what we're doing right now, if we get about 80% of or 70% of the people who are infected into isolation, we've beaten the pandemic. We're done. Now, the only way anybody knows to get 70% into isolation, of 70% of the infected in isolation right now, is to try and put all of us in an isolation. That's not sustainable. But if you just test to figure out who's infected, then you put 70% of them, or catch 70% of them, put them in isolation, you're done. And that's the plan we need to do, is how do we get to that alternative?
And Jillian, I would just add briefly
right,
that we are working, in fact, with scientists, with industry leaders, with economists like Paul, and frankly, with mayors, governors, and we hope even the Trump administration to put together a public-private collaboration that can scale testing from hundreds of thousands a day to many millions a day. It's not the kind of thing any one part of American society can do alone. So we're bringing people together to get that done. And that's the plan that you were describing. We're seeing real progress already. You know, Los Angeles is very quickly scaling access to testing using NGOs and other partners. Detroit has partnered with Abbott. New Orleans got a waiver from the federal government and has been able to test 6% of their population in a collaboration with the Trump task, with the Pence task force. So, you know, this is an effort that can work, but it's going to take all of us working together, and it's going to take a massive investment. Paul has estimated that even a $100 billion investment in the space would be appropriate.
Well, gentlemen, we've got to leave it there. Unfortunately, we'd love to have you back to talk more about this. We wish you the best of luck with the strategy. Raj Shah and Paul Romer, happy Easter.